Hello.
Hi.
This is my daughter Maylee and our little dog Emmy. She's a Yorkie. Santa Claus brought her. My son's here too, but he's watching PJ Masks in a bedroom somewhere. So
No.
is he not?
Spider-Man.
Spider-Man. He's watching Spider-Man. All right. Well, this is my attempt at a video, so I thought I'd let my kids be a part of it since we don't have to. We don't get to go to Brad and go do the pediatric thing. So I figure I'd bring my kids to you guys. So here we go. I wasn't sure how to do this, so I'm going to record myself off my computer, and I have the Google Slides pulled up on my phone, so I'm just going to kind of go slide by slide. If you want, once you get the slides, you can just access it, and you can just follow along as I go.
And
So
he almost got ran over.
I can drink of water first. Yeah. Okay. My first topic is nephrotic syndrome. According to MayoClinic.org, this is a kidney disorder that will cause your body to pass too much urine. This is usually caused by damage to clusters of small blood vessels, the glomeruli, in your kidneys that filters waste and excess water from your blood. Some signs and symptoms: severe edema. This can occur around the eyes and also in the ankles and in the feet. Foamy urine. This is from the excess protein that's spilled over. Fatigue and loss of appetite. All right. This is continued. Why are you drinking your soda in front of everybody? All right. Possible causes. Diabetic kidney disease is a possible cause. Let me see here. Look at my notes. Minimal change disease. That's the most common cause in children. I highlighted that in blue since that's relevant to what we're talking about. Says this is odd because when examined under a microscope, the kidney tissue looks normal, though there is abnormal function that can't not always be narrowed down. So the kidney might look normal, the tissue does, but there's some abnormal function that they can't quite determine. And also another possible cause is focal segmental glomerulosclerosis. That's a mouthful. This occurs with scarring of the glomeruli. This can occur from another disease, a genetic defect, medications, or for no known reason. Another possible cause is membranous nephropathy. Mary, can you let me at least get in front of the camera? This happens when membranes within the glomeruli thicken. This is made by deposits from the immune system. Can be associated with lupus, hepatitis B, malaria, cancer, or for no reason at all. Another cause is systemic lupus erythematosus. This is my son, by the way, Roston. Say hi.
Hi.
Hi, everybody.
Hi, babe.
Where was that? Systemic lupus erythematosus is a chronic inflammatory disease. Another cause is amyloidosis. This occurs when amyloid proteins... Bob, don't push any of the buttons. This occurs when amyloid proteins accumulate in organs, which damages kidney function. Certain medical conditions that can damage your kidneys are diabetes, lupus, amyloidosis, reflux nephropathy, and other kidney diseases. Certain medications that are risk factors include non-steroidal anti-inflammatory drugs and also drugs used to fight infections. Certain infections that are risk factors are HIV, hepatitis B, hepatitis C, and malaria. All right. Those are your risk factors. This is the third slide that I had. Diagnosis can be obtained by urinalysis, a CBC, cholesterol studies, creatinine and urea nitrogen, albumin, kidney biopsy. Mainly, urinalysis can reveal large amounts of protein that are spilling over. Low levels of albumin are indicative as well as low levels of protein in the blood. Loss of albumin also increases cholesterol and triglycerides. Creatinine and urea nitrogen can also be measured. Why are you showing them ketchup? All right. Some treatments for nephrotic syndrome are as follows. Blood pressure medications, which are your ACE inhibitors such as lisinopril, benazepril, captopril, and enalapril. Also, ARBs or angiotensin II receptor blockers, such as losartan and valsartan. Renin inhibitors may also be used, but the other two are used first. Hey, try to. Okay. Diuretics is another treatment. This increases the fluid output of the kidneys. Some examples are Lasix, which is furosemide, spironolactone, hydrochlorothiazide. Hey, shh. Try to be quiet. And metolazone. Statins such as atorvastatin, Lipitor, fluvastatin, lovastatin, prevastatin, rosuvastatin, and simvastatin can help lower cholesterol levels. Though it said, according to MayoClinic.org, it is not clear whether this can improve outcomes of people with nephrotic syndrome. But cholesterol-reducing medications is one of the treatments. Anticoagulants is another treatment. May be prescribed to keep your blood from clotting. Heparin, warfarin, apixaban, which is Eliquis, rivaroxaban, Xarelto are examples. And also immune system suppressing medications are another treatment. Examples of these include rituximab, cyclosporine, and cyclophosphamide. All right, I'm on the fourth slide now, which is complications. Some complications are blood clots, high blood cholesterol and elevated blood triglycerides, poor nutrition, high blood pressure or hypertension, acute kidney injury, chronic kidney disease, and infections. Mainly, I'm trying to give a presentation, so I'm showing the random stuff. The risk of having a blood clot increases because glomeruli cannot properly filter blood, which leads to a loss of blood proteins, which helps to prevent clots. Albumin level in the blood falls, which prompts the liver to make more albumin. At the same time, your liver also releases cholesterol and triglycerides. Malnutrition can be a result of a loss of too much blood protein. Weight loss can happen, but this can be hidden by edema, so watch out for that. Low levels of red blood cells, anemia, low blood protein, and low levels of vitamin D may also occur. Excess body fluid from the dysfunction glomeruli can raise blood pressure, hence the hypertension. Waste products can also increase with any kind of acute kidney injury, and dialysis may be necessary as per above. If the kidneys lose enough of their function, the patient may require dialysis or a kidney transplant. Also have increased risk of infections, like I said. We're on the next slide now, which is the nursing care. You need to monitor your eyes and nose, maintain adequate nutrition, preserve skin integrity, maintaining rest to conserve energy, preventing infection, and providing family education. You need to have the family make a list of child symptoms and when they began. Any personal information such as recent life changes or major stressors. Also, Bailey, please don't push any buttons. Also make a list of medications, supplements, or vitamins that your child receives, and make a list of questions to ask the doctor. And some example questions that I had on Mayo Clinic are, what is the most likely cause of my child's nephrotic syndrome? What tests will be needed? Is this condition likely temporary? What are the treatment options? Any changes to child's diet to consider and enact? How best can I manage this with my child's other medical conditions if applicable? And are there any informational packets or educational material that can be provided? So those are all good questions that you can have the family, the parents ask the doctor when they speak with him or her. Okay, I'm on my second topic now, which is Wilms tumor, also called nephroblastoma. According to kidshealth.org, Wilms tumor is a rare kidney cancer that can affect both kidneys, but usually just develops in one. Doctors believe that this develops. Maylee, what are you doing? Yeah, they're watching PJ Masks. Usually just develop in just one. Doctors believe that this develops during the womb, but instead of cells developing into healthy kidneys, they develop into a tumor, unfortunately. This is one of the most common neoplasms of early childhood. Some signs and symptoms of the Wilms tumor or nephroblastoma are going to be look for a firm, smooth lump in the child's abdomen, nausea, stomach pain, hypertension, hematuria, loss of appetite, fever, constipation, or any shortness of breath. Before being diagnosed, most children show no signs or symptoms of having cancer. The mass in the abdomen can grow quite large before discovery, on average 1 pound at diagnosis. Though they are large, most have not metastasized to other parts of the body, which is good. It goes without saying that this helps with treatment. As a result, this is highly treatable and children could go on to live normal lives. All right, I'm on the next one. Take a drink of water real quick.
Genitourinary.
We're having an intermission. She's going to dance for the intermission.
Yeah.
All right, continued. Ways to diagnose Wilms tumor. Mainly, you have to. Okay. All right. Ultrasound, CT and CAT scan, MRI, X-rays, bone scans, lab tests such as blood tests, CBC, and urinalysis. And the prognosis is best for a child younger than 2 years of age. Ultrasound is usually the first diagnostic test conducted. X-ray, CT, and CAT scan can look to see if the tumor has metastasized to other parts of the body. We're on the next slide now. The causes of Wilms tumor are going to be genetic, a family history of Beckwith-Wiedemann syndrome. Beckwith-Wiedemann syndrome, I had to look up, is a condition that results in larger than normal internal organs. Children also tend to be significantly larger. WAGR is another cause. It stands for Wilms tumor, aniridia, which is absence of the iris, genitourinary anomalies, intellectual disability. It used to be called mental retardation. That's where the R came from, but now they call it intellectual disability. This is marked by defects of the iris, kidneys, urinary tract, or genitalia. Another cause is Denny's-Drash syndrome, which is a defect of the genitalia. Most females have normal genitalia, but it can affect the sexual development of males and also results in abnormal kidney function. Pseudohermaphroditism can occur with this, which is when a boy is born with testicles, but may also exhibit some female characteristics. According to kidshealth.org, children with risk factors should have an ultrasound screening every 3 months until age 6 or 7. And also, African American race or family history of Wilms tumor are also risk factors. Continued treatments are a radical nephrectomy or a partial nephrectomy. In a radical nephrectomy, the surgeon removes the tumor, the entire kidney, its ureter, its adrenal gland, and any surrounding fatty tissue. If cancer is in both kidneys, then they usually try to remove as much of the cancer as possible while leaving healthy kidney tissue in order to avoid a kidney transplant. All treatment plans include both surgery and chemotherapy. Some more advanced stages of the tumor may require radiation therapy. Next slide. Wilms tumor, nursing interventions and education. No special nutritional needs and no medicine for low blood cell counts like other cancers, so that's good. Have a parent watch for signs and symptoms such as fever, nausea, vomiting, or diarrhea. Bring a special toy or book for your child to keep them occupied during medical appointments. Include playtime in your child's schedule. Seek available support. Monitor your child's energy level. Keep a daily record of child's condition. Plan a normal diet with favorite foods. Good oral hygiene must be practiced. Check with the doctor before any vaccinations because chemotherapy can affect the immune system. What you got there, bub?
Yes.
Cool. Where are we at now? Sign must be visibly posted stating not to palpate abdomen. This is one of the things in Ms. Green's PowerPoint, so I wanted to emphasize that as well. So make sure that there must be a sign visibly posted stating not to palpate the abdomen. Make sure to be open, honest, have open, honest communication with the child about their condition. Keep track of child's daily body temperature, energy level, sleeping patterns, and any drugs administered and their side effects. Chemotherapy may affect their appetite, so keep that in mind as well. Now we're on my last topic, which is hydrocele. According to PowerPoint provided to us, hydrocele is a collection of peritoneal fluid that collects in the scrotum. According to mayoclinic.org, hydrocele is common in newborns and usually disappears by age 1. Some signs and symptoms are painless swelling in one or both of the testicles, usually the only sign. Pain increases with size of inflammation. Discomfort will happen due to heaviness of scrotum. Sometimes the scrotum will be small in the morning and then larger in the afternoon, so it can vary. So Causes in baby boys, this can develop before birth. There's two different kinds. There's a non-communicating hydrocele and a communicating hydrocele. In a non-communicating hydrocele, the fluid remains after the sac closes, and usually the fluid is absorbed in the first year of life. When the sac remains open, it is a communicating hydrocele. These are often associated with inguinal hernias. The sac can change size, and if compressed, fluid can flow back into the abdomen. Older males can develop this also as a result of injury or inflammation within the scrotum, according to the Mayo Clinic. Risk factors. Most hydroceles are present at birth. At least 5% of newborn boys have a hydrocele, so it is pretty common, I guess. Babies born prematurely have a higher risk of hydrocele. So any babies born prematurely, that risk goes up. What else do I have here? According to MayoClinic.org, normally the testicles descend from a developing baby's abdominal cavity into the scrotum. A sac accompanies each testicle, which allows fluids to surround the testicles. Usually each sac closes and the fluid is absorbed. So it's usually what happens, but if not, then you get a hydrocele. So, okay, the next slide. Diagnosis, going to be either a physical exam by your physician. The physician will check for tenderness and an enlarged scrotum. They will apply pressure to the abdomen and scrotum to check for inguinal hernia. They will also use transillumination, shining a light through the scrotum. This transillumination will show clear fluid surrounding the testicle. Where are we at now? Also, blood and urine test to rule out an infection such as epididymitis. I'm saying that right? The epididymis is a tube located at the back of the testicles and can become inflamed. They may need a tube to drain fluid after a hydrolectomy for a few days, and also a Boki dressing as well for a few days. Another diagnosis, ultrasound to rule out hernia or other causes of scrotal swelling. Treatment, sometimes it disappears on its own, like I was saying, but still needs to be evaluated by a doctor to make sure. Surgery such as hydrolectomy may be performed under general or regional anesthesia. It's usually an outpatient procedure. Let's see what I got next. Nursing interventions and education. Have the parents list symptoms and how long they have occurred. List all medications, supplements, and vitamins that the child takes. Prepare pertinent questions to ask the doctor. List key and personal information such as recent life changes or stressors. Some basic questions that included to ask your doctor. What do you think is causing the swelling? Are there any other possible causes? What kind of tests are needed? What treatments, if any, are recommended? What signs or symptoms will indicate that it's time to treat this condition? Are there any restrictions on activity? That's a pretty good one, that last one. And that's it. That's all I got. So I'm finished here, and I did 18 minutes. That's awesome. Kids, you want to come say goodbye? You got to do it right now. Come on. Say bye.
Bye.
Bye, everybody.
Bye, everybody.
Bye. Can't wait to see y'all again. I miss everybody.
Yeah, I miss everybody too.
Hope everyone's healthy.
Bye. No.
You want to push the red button?
I want to. First, I want to show it to Felix.
You want to show them our fish?
Yeah, do you?
Well, we have a fish. She wants to show you Felix the fish. All right.
Bye. Oh.
Bye.